Hi, everyone. It's Dr. Arlene Diamco, the multidimensional MD. Today, I'm going to talk about all things zinc because it's so needed right now, especially given the season, the winter and cough and flu season. And so I'm going to talk about signs and symptoms of zinc deficiency, why you might need it, the role of zinc in the body, checking labs and variations on that, recommended amounts and what could vary those recommendations, food sources of zinc, forms of zinc supplementation, as well as precautions and toxicity, and my thoughts on the energetics of zinc. And as always, my approach is to help bring the intuitive aspects of medicine back to health in practical, intangible ways so that you can access deeper healing and more peace, joy, love, connection in your everyday lives. So let's go ahead and get started. Zinc is involved in so many different processes, and I'm going to talk about the roles of zinc in just a moment. But first, you want to know, what are the signs and symptoms you might need zinc? There are so many, and of course, zinc does not work in isolation, but it is involved in most every part of the body and every system. And so if you have any cognitive problems, so memory issues, focus issues, difficulty making decisions, think of zinc. If you have stress and anxiety or trouble calming yourself, feeling down, angry, or irritable, think of zinc. It's also involved with allergies, asthma, eczema, and other rashes, including acne and other skin things, such as hair loss, stretch marks, acne, premature graying. And there are various studies on how zinc is being used. So first, in terms of cognition with ADHD, it's really common to supplement with zinc, and that can really help with focus and calm. And in terms of allergies, asthma, and eczema, there are also many studies with that as well. We know that's really important in wound healing, in skin ulcers and burns, and it helps with the generation of collagen and other fiber-like tissues. It's also important in terms of bone mineralization and strength. It's really important in terms of your immune system. So if you're getting frequent colds or illnesses of any kind, then think about zinc. Whether it is just a common cold, we know that if you start zinc supplementation within the first 24 hours of a cold, that it can reduce the duration of the common cold. Also reduces your risk of pneumonia, malaria, and diarrhea in terms of both GI infections and other kinds of diarrhea. Because zinc is also important in terms of digesting protein. So if you haven't heard of anything yet that applies to you, then I'm going to keep going. But there's so many ways that zinc can help you. It's important for I was talking about your skin, but it's also important in terms of your nails. So if you have fragile or thin nails, or if you notice any little white spots on your fingernails, on your toenails, then you know that you need some zinc supplementation. And then you start to think about the other things that it might be helpful with as well. So it's something that I commonly check in kids and adults, is especially depending on what they're talking about. But if you just take a quick look at your nails, any white spots there, you know you need zinc. These other things, you may or may not need zinc, but to consider it. So the more things that you have on this list that point towards zinc deficiency, then really start thinking about zinc. It's important in terms of vision, so it can help prevent age-related macular degeneration. It also works hand in hand with vitamin A, and both vitamin A and zinc are necessary for night vision. So if you have trouble seeing in the dark or at night, think of zinc. It's great at reducing excessive body odor. So teenagers, adults, if you feeling like you are having a trouble reducing that body odor, then think of zinc supplementation. It's also important in terms of fertility issues. as well as abnormal or absent menstrual periods. And it's important in growth and development. If you see like slowed growth during puberty or any growth issues, even early on in infancy, toddler, early childhood, and developmental issues, coordination issues, think of zinc. And if you have any blood sugar balance issues, especially type 1 diabetes, um, then there have been some studies showing that zinc can be helpful in regulating blood sugars. We know that zinc does work in the beta cells of the pancreas to produce insulin and store insulin, also helps stimulate glucose uptake and metabolism. So it makes sense that it could potentially be helpful with type 2 diabetes and gestational diabetes. But the studies right now have been inconclusive. And for me, I feel that's because that, of course, again, zinc doesn't work in isolation. It's with total health, total balance of health. But it is one aspect to consider. It's important in cardiovascular health, in prostate health, and in your taste. So if you're having trouble tasting things, then also think of zinc. So the zinc has multiple roles in the body that span so many different enzyme processes. So it's a catalyst, which means that it speeds up enzyme processes, and it's involved in over 200 known enzyme reactions, including what I mentioned before, the digestion of proteins in the GI tract. It's also a cofactor in about 3,000 zinc metalloproteins, which are important for gene expression because these metalloproteins are transcription factors for gene expression. They also help with mineral homeostasis, so other minerals, calcium, magnesium, zinc, copper, with oxidative stress for the detoxification of heavy metals like mercury, aluminum, so things that are not your body's not supposed to hold on to. It allows for RNA, DNA, and protein synthesis. So zinc has a really important role in the body, has many roles, in fact. Um, these roles can be divided in like three things. So it's catalyst, it has structural role. So those cofactors also help with the shape of the proteins in the body. And those shapes of the proteins are part of the reason why they're able to act as transcription factors for gene expression. So it stables the folding of certain proteins in the body. It is also important for regulatory signaling. So the communication between cells in your body. Isn't that amazing? Like how your cells communicate with each other, send messages to and from. And so it's vital in that information transfer. It's also important with hormones, endogenous steroids, including estrogens, thyroid hormones, vitamin D, and vitamin A. So many of those fat related steroid hormones are relying on zinc. And when in doubt, you can always check labs, especially if you're considering long-term supplementation or using doses higher than usual. So the most common way to check for zinc is to check a plasma zinc, which is much more reliable than serum zinc, which is more easily contaminated. So often, ideally, when I check zinc levels, I'll compare a plasma zinc to a copper, uh, I'm sorry, the serum copper ratio. So the ideal serum copper to zinc plasma ratio is 0.7 to 1.0. The median for copper zinc ratios in people that were more aggressive was 1.4, and that was compared to 1.02 for controls. So that is very statistically significant. So Dr. William Walsh, who is a PhD in nutritional medicine, he has studied over 10,000 people comparing like different nutritional needs and everything. And this is what he found, that the copper zinc ratio is really important. So copper elevation is often related to zinc deficiency. So those two kind of help to balance each other, but you need both. So that's one thing. Um, the red blood cell zinc, so zinc stored inside the cell, is also another way to check zinc levels. It's more reflective of a 3 to 4 month um, levels of zinc. So it can be helpful for like knowing your zinc levels over time. And there are different kinds of information, both very helpful, but different ways to look at it. Urinary zinc is another common way for check zinc. I'll check that with some of the Genova labs as well as other specialty lab tests. It's a really easy way to get it if you can't if you have trouble like with younger kids or it's just difficulty to get to the lab and do a blood draw. So it's not as reliable as the blood test, but again, still can be really helpful. You just have to be aware of that. Things can alter the lab numbers. Hair zinc, if you're familiar with hair testing, can be helpful as well. Dr. Walsh has noticed that the copper zinc ratios also were important if you're looking at hair levels. It's hair testing is not quite as common as blood testing, but still can be helpful. Dumpling! Shh! I'm on a live. Okay, so another way to check zinc levels is to do a taste challenge, and there's various taste challenge tests that are available. These are helpful, but also subjective. But the real premise is you hold the zinc, a couple spoonfuls of zinc in the zinc liquid in your mouth, and if you don't taste it right away, then you know you're deficient in zinc. Or if you do taste it and then it has like a different taste or feels fuzzy or dry or sweet or just minerally, then you're deficient in zinc. If you taste it just a little bit, like it's like a little bit metallic, then you are, somewhat deficient in zinc. If as soon as you taste that liquid, for the zinc taste challenge, if you taste a metallic taste in your mouth right away, then your zinc levels are good. So I haven't used it as much, but it would be interesting to use it. And it is more subjective. So that would be the downside to that. In terms of recommended amounts and variations, the recommended daily allowance for adults is 11 milligrams for men, 8 milligrams for women. And the tolerable upper intake level is 40 milligrams daily for adults. For toddlers ages 1 to 3, this is 7 milligrams. For young children ages 4 to 8 years old, it's 12 milligrams. Now, the point of these upper levels to remember is that this limit doesn't apply if you have a zinc deficiency or higher zinc needs, such as with extensive wound healing or serious illness. You may need higher amounts, and that would be completely okay and not at risk for toxicity. So these are more assuming that your zinc levels are okay, or if you're taking it like for a long time and your zinc levels will somehow rise to more normal values. There are some issues that can increase your need for zinc. So again, it's the extensive wound healing or illness, inflammatory bowel disease or GI surgery can reduce the absorption of zinc. So can chronic diarrhea of any kind. Antacid use can also decrease the absorption of zinc. Excess alcohol can decrease zinc, and pregnant women also need more zinc. A note is if you're nursing, breastfeeding, that the breast milk alone does not provide adequate zinc once infants are about 6 months old. Until then, solely breastfeeding is completely fine and encouraged. And then after that, the infants do need to start getting some solid food. Children with sickle cell tend to need more zinc, as do people with chronic renal disease, and people with type 2 diabetes tend to have low zinc levels. We were talking about blood sugar balance earlier. There's also a rare disorder called acrodermatitis enterohepatica, which is a genetic disorder that disrupts the uptake and transport of zinc. And that requires lifelong zinc supplementation to prevent symptoms. Zinc can also interact with certain antibiotics. and medications, prescription medications. So thiazide diuretics, hydrochlorothiazide, used for blood pressure control, to remove fluid from the body, can increase zinc loss in the urine. The zinc can also interfere with tetracycline antibiotics and quinolone antibiotics, and it can also interfere with penicillamine, which is used for rheumatoid arthritis. This is not the same as penicillin. So the best way to get zinc is through food sources, but sometimes you do need supplementation. I prefer food sources because, of course, you are getting it with a more balanced mineral content, and so you're less likely to get into the side effects or toxicities of zinc, which we'll talk about in just a moment. So food sources include sprouted beans, including soy, chickpeas, and whole grains, sprouted whole grains. So what sprouting does is to help reduce the amount of phytates in the beans and grains that decrease zinc absorption. So sprouted grains are getting to be much more easy to purchase in the grocery stores, or you can sprout yourself or at least soak the beans overnight to reduce that. Nuts and seeds are also great sources, like pumpkin seeds, pine nuts, cashews, pecans, Brazil nuts, almonds, chia seeds, flax seeds, hemp seeds, and flower seeds. Those are all really great nuts and seeds that have a good amount of zinc. Shellfish, especially oysters, has a high content of zinc. In terms of other animal products, eggs, beef, turkey, sardines are good sources. And then mushrooms are also a good source of zinc. And luckily, chocolate. So dark chocolate. Again, anytime you're craving minerals, then you may have that chocolate craving. So if you love chocolate or you just feel like you need to eat chocolate every day, then that may be one reason that you need more minerals. So let's look at forms of zinc supplementation. Zinc, what a form of zinc supplementation you're supposed to avoid is intranasal zinc, because this can decrease your sense of smell acutely or chronically. So that is not the best form. Other forms of zinc are through capsules, powders, or liquids. And if you're getting those internally, then the two best forms of zinc to take are zinc picolinate and zinc citrate. These are the best absorbed, followed by zinc gluconate, then zinc oxide. So the least absorbed form of zinc is zinc sulfate. It's also the least expensive, so it is actually commonly used in a lot of supplements. But clinically, I find that if my patients are taking this form of zinc and we are really wanting to get the benefits of zinc, I really don't see as good results. And it's probably just because absorption is really poor compared to other forms of zinc supplementation. So I would recommend not to get zinc sulfate. If you really want to get your zinc levels up, then to use a good form of zinc, so that's zinc picolinate or zinc citrate. Those are the best ones. Again, the medium absorption is zinc gluconate and zinc oxide. There are also zinc creams, like zinc oxide, which was used by the ancient Greeks for wound healing and is still used in popular diaper creams. It's also helpful for burns, eczema, sores, and as a sunblock to help deflect sun rays. Another one of my favorite forms of zinc is it's also used in some mouthwashes as well. So, I have to check on that. Sorry about that. So, but the zinc creams can be really helpful for wound healing as well. So, in terms of some precautions, again, don't use intranasal zinc. High doses of zinc, of 50 milligrams or more per day for several weeks, can cause copper deficiency, which can lead to neurological symptoms such as numbness and weakness in the arms and legs, or other neurological issues. And high doses can also interfere with other mineral absorption, including iron deficiency. So iron, copper, zinc, they all compete for absorption. So if you are taking higher levels of iron, then that can reduce your zinc absorption. So some people recommend, if you're taking iron, to also take zinc at the same time. Now, if you are getting iron through food sources, then it's a more balanced way to absorb it. So this doesn't seem to be the case in terms of food intake. It's more, they see it with supplementation. If you're getting too much zinc, then it can create dizziness, headaches, indigestion, nausea, vomiting. You can have poor appetite and abdominal pain or cramping and diarrhea. So that's interesting, because there's some of the things that zinc can help with that it can create toxicity for. So that's why, if you're not sure if you need it, then to check your labs or talk to a qualified health professional. And lastly, I wanted to mention some of the energetics of zinc, because was thinking about this. I took Veda Austin's course on water crystal photography and her water master class. And water, which we are mostly water, we're like 50 to 60% water, holds information. But water holds information even better when it has minerals in it. So we are really meant to be like these liquid crystals to hold and emanate information, to be able to communicate within ourselves and to each other. So that mineral in water can help with information storage. And so zinc is a mineral. And so if you're deficient in zinc, then to me, I'm wondering how your intra-communication, intercommunication is. So if you need zinc, if you need more minerals, that can help with the structure of the water in your body and help you carry information more, help you communicate better with people. And we know that zinc can help with your cognition, so your ability to calm and focus, and your mood. And so for me, I see that zinc also can help you access your intuition, because you do need your physiology to be intact to be able to better access your intuition. And so we don't always talk about these energetic aspects of with the minerals and what we're taking in. But I just wanted to mention this, because always looking at a multidimensional approach. And if you are having trouble with relationships, if you're irritable, anxious, angry, or feeling down, then you could need more zinc and minerals in your diet. So just to consider that. It's more than just about the nutrition. It's really more about how you feel and function in your whole life. So it's body, mind, and spirit. So I hope that, I know this was a lot of information today, and I went relatively quickly. So if you have any questions on that, then please feel free to let me know in the comments, and I'll help to clarify. And if you have any other ideas for things you would like me to go over, then also let me know in the comments. I always love to hear from you. If you'd like to connect with me further, you can on Instagram at All Worlds Health, on Facebook, All Worlds Health and Pediatrics, and you can always sign up for my e-love letters at allworldshealth.com. I send them out every week on Wednesday. So I hope that helps you in some way, and have a beautiful rest of your week. I will see you next Wednesday around 11 a.m. or so Eastern Time. Lots of love to you, and enjoy the rest of your week. Take care. Bye.